Apologise. I've missed a Zoom for this tonight. I don't give a shit anymore. I just want to get this finished because this is right near the end of the swine flu thing. So I want to do part 2 while I'm on it. Both the vaccine and adjuvant have been carefully evaluated by European regulators, and the Department of Health, the World Health Organization, has also reviewed the safety of adjuvants and found no cause for concern. Clinical trial data is being collected and monitored all the time, and doctors and patients are encouraged to report any side effects now. Let's not forget that the swine flu vaccine caused, what was it? It's either 80 or 800. I am not keen. Well, yeah, I'm not keen on the figures, but I'm not sure of the figures. But there's either 80 or 800. I know that either 80 or 800 million was paid out on this 80 or 800 people, young people who were given brain damage from the swine flu vaccine. They contracted epilepsy. So those kids children who had that swine flu vaccine have been permanently damaged and are now just slaves to the system. Literally, they make numbers go round for the big guys. They depend on medicine and handouts, and that's what they don't want us doing anything for ourselves. You know, like, it's all about, we give you this, you do what we say. Right, so that one, let's go back. So we started in April on video 1. Started in April. That last one was on the 18th of November. This one is on the 21st of November. Expert warning. Thanks, experts. We love an expert over new swine flu. Tamiflu resist. Now, I have a Tamiflu prescription somewhere in my house. I didn't cash it in. I had suspected swine flu. And the doctor turned up on my doorstep at the end of the gate, and we sort of like exchanged the thing like this and whatever. It was, but I do have that. Sorry, I can't see through my glasses. I do have that somewhere, because it's like, that's one of those things. That's one of those mementos you want to keep, right? Tamiflu resistant swine flu, which has broken out in Wales, will become much more common as the virus mutates, a flu expert says. Again, they're my air quotes. Because experts, like, just spout loads of bollocks. You can see it from corona bollocks. You can see it from swine flu. Like, they're saying the same fucking things. You know, they're using words like unprecedented, and it's the same thing. They're saying to people, don't touch each other. All of this fandango, right? 3 out of 5 patients diagnosed with the Tamiflu resistant strain. How can you diagnose somebody with that? I'm sure you can. Like, oh, well, they've got swine flu. But did they test for swine flu? Because there's no test for COVID-19. What are these people testing for? Remain in hospital after it was revealed they could be the world's first cases of person-to-person transmission of the virus, the National Public Health Service for Wales said. Professor Neil Dimmock, a virologist at the University of Warwick, said, "This is just the beginning. You have got a lot of viruses, and if you use Tamiflu at the level they're using it, you get resistance. However, they probably aren't resistant to Relenza, the other antiviral." Thanks, Big Pharma. You need other mutations to make it resistant to Relenza. So basically, shit will become resistant to whatever you throw at it. So why keep throwing shit at it? Why not find natural ways to overcome that shit? I don't get it. Also, the vaccine is coming on, so people regard Tamiflu as a stopgap, and there's no need to panic. There's no need to panic because there's going to be a vaccine coming up, and that vaccine is going to fucking make children brain dead, mate. Or not brain dead, but it's going to give them fucking narcolepsy. So literally, they can't function on everyday society level. They will just fall asleep wherever they stand. You want that for your children? You really want that? Give me a sec. He added it was unsurprising person-to-person transmissions had started. He said this is the trouble with going into hospitals. This I found funny. Where you can get MRSA, C. diff, norovirus and so on. You go in with something and you come out with a virus. It's a well-known problem. 2009. 3 of the 5 people on a unit for severe underlying... 3 of the 5 people on a unit for severe underlying health conditions at the University Hospital of Wales in Cardiff appear to have acquired the infection on the ward, the MPHS said. 2 of the 5 have recovered and have been discharged from hospital with severe underlying health conditions. 1 is in critical care and 2 are being treated on the ward. Professor Dimmick said that the likelihood of the cases in Cardiff causing an outbreak of the resistant strain depend on how well the virus has been contained. Do you remember this all happening back in 2009? Them containing the virus, staying alert, control. Then in 14th of January 2010, the UK government has abandoned its weekly swine flu briefings in another sign that the crisis, again, has eased dramatically. New cases in the UK plunged over the past month, prompting the Department of Health to abandon its regular media briefing. A government spokeswoman said, given the lack of sufficient new content, the department has decided to stand down the weekly swine flu briefings. However, if there are any emerging developments, we shall restore these. To ensure that journalists are kept up to date with statistical trends, the fortnightly bulletin will be issued starting Thursday the 21st of January, together with an interpretive quote from the Chief Medical Officer. What the fuck is an interpretive quote? Is that a quote delivered in interpretive dance? I don't know. It was announced last week that there were fewer than 5,000 new cases of the disease over the previous 7 days, down from an estimated 9,000 in mid-December. That's all I have on it for now, except for this. Swine flu. This was in my Leicester bulletin thing. Leicester is ready in the event of an autumn second wave. Again, do you see the repetition here? Second wave. In swine flu cases, Dr. Tim Davis, on behalf of the NHS in Leicester, Leicestershire and Rutland, said the National Swine Flu Helpline and Internet Service have played key roles in assessing who needs antivirals. So we've been... Antivirals. Viral says it's virus. Why have we had no antivirals in this? If it's antivirus, why... I don't get why we've not had antivirals in this. But typical right. Typical symptoms are fever, a temperature of 38 or above, and sudden cough. Other symptoms may include headache, tiredness, chills, aching muscles, limb or joint pain, diarrhea or stomach upset, sore throat, runny nose, sneezing, loss of appetite. Thankfully, swine flu is quite mild, with the majority of people recovering fully within a week through rest and medication. The area's more serious cases are mostly affecting people with underlying health conditions. Checking symptoms. If you think you have swine flu, stay at home and check your condition using the national pandemic. They're saying that swine flu was a pandemic, and it wasn't. It wasn't a pandemic. There was a lot of research on how a pandemic moves. In fact, just watch Pandemic on Netflix. It was brought out about within a week of coronavirus being touted as a thing. High risk groups. Some people are more at risk of serious illness if they catch swine flu. It is vital that these people in these high risk groups who catch swine flu start taking antivirals as soon as possible. This applies to people with the following conditions: chronic lung disease, chronic heart disease, chronic kidney disease, chronic liver disease, chronic neurological disease. Neurological disorders include motor neuron disease, multiple sclerosis, and Parkinson's disease. Immunosuppression, whether caused by disease or treatment. Whether caused by disease or treatment? If you have an immunosuppression problem, you either have had that from disease or from treatment. They've said if you've been treated for something and it's caused you to have an immunosuppression problem, they did, didn't they? Diabetes mellitus, i.e. type 1 diabetes. The same warning applies to patients who have had drug treatment for asthma within the last 3 years, pregnant women, people aged 65 and over, and children under 5. So everybody who's basically having some sort of problem, give him the vaccine. Because that's going to help everybody out. You want to go for the big, right? Self-help. There are things we can all do to prepare in case we get swine flu. Set up a list of flu friends. That is actually there. Friends, relatives, neighbours or colleagues who can help you if you fall ill. They are people willing to collect medicines and other supplies on your behalf. Make sure you have a thermometer and adequate quantities of cough and cold remedies at home. Help reduce the spread of swine flu. Cover your nose and mouth with a tissue when coughing or sneezing. Dispose of dirty tissues promptly and carefully. Wash your hands frequently with warm, soapy water. Always wash your hands before eating or handling food. Make of it what you will, mate. But at the end of the day, that's, as far as I'm concerned, Deja Flu. It's the same fucking thing. They use the words unprecedented. They literally have just repeated themselves. What we're going through now, we went through back in 2009. It just didn't work. It did. It did, otherwise there wouldn't be fucking 80 or 800 kids in Europe who had fucking narcolepsy specifically because they'd had that vaccine. Do I want that vaccine? Do I want it like shit? I didn't have Tamiflu that I was, like I said, I've got somewhere as a memento, my prescription for Tamiflu. And I weren't going to have a fucking vaccine, and I ain't going to have the vaccine for this either. And I just say to everybody, they'll keep rolling it out. Don't fall for it, because one day we will win. These people are not on our side. They've never been on our side, and they keep rolling out the same shit over and over again. And surely there's got to be a time where we add this shit up and realise, like, well, hold on a minute, love. What you're saying now, like, you've already told it me before, and there was nothing in that. There was nothing in it. So why are we believing them when they say it now? Just don't believe them. Like, at the very least, ask questions. You know, like, don't just go like, oh,